Lipoprotein A is a type of LDL bad cholesterol.
Lipoprotein think of it like a cholesterol particle. So you may have heard of LDL cholesterol as part of the routine lipid panel. Lipoprotein A behaves very similarly to that LDL cholesterol in that it's a cholesterol particle, cholesterol-containing particle, I should say, and it's a risk factor for heart disease.
Dr. Ashish Suraju is a preventive cardiologist at Cleveland Clinic.
Lipoprotein A is diagnosed with a simple blood test. It's not part of your standard fasting lipid panel, so it has to be ordered separately generally. But that will give people an indication of whether it's higher than it's supposed to be.
Your doctor may consider testing lipoprotein A if you have a family history of heart disease, high LDL levels on your most recent lipid panel, recurrent heart events like heart attacks and stroke despite managing your risk factors, or if a family member has elevated lipoprotein A.
In terms of treatments, there are no currently approved treatments to lower Lp(a) levels or lipoprotein A levels. So our treatment for patients who have elevated lipoprotein A levels is to look at their overall risk factors and try to improve or optimize all the other risk factors as intensively and aggressively as we can.
Cleveland Clinic researchers are studying possible medications to control lipoprotein A.
Some people believe that every adult should have a lipoprotein A checked at least once in their lifetime. And I say once because lipoprotein A tends to be controlled by genetics more so than lifestyle. So if you have a family history of heart disease, especially if people who are directly related to you have had heart attacks or strokes or stents or bypass surgeries when they were young, in their 40s or 50s, and there's no other explanation for that, certainly you should have your lipoprotein A checked as a potential genetic cause in the family. Now, lipoprotein A, again, although it is gaining more prominence, still not everybody knows about it as a very common genetic risk factor. The other thing about genetics is you're not entirely chained to your genetics. So even if you have a genetic risk factor, we can do things to reduce your risk still. And once you've confirmed that it is elevated, my recommendation would be to find somebody who has experience and who's comfortable interpreting that test. So find a physician who can help you interpret it and then try to figure out what risk factors could be made better. Certainly lifestyle, but perhaps blood pressure, perhaps glucose, perhaps LDL cholesterol, perhaps there's a need for medications to reduce your risk, but really speaking with a physician who's comfortable with that is the best next step.
For Fox 8, I'm Dr. Mark.
Dr. Mark is sponsored by the Cleveland Clinic.